Hello, everyone, and welcome back to the blog. Today, I'd like to talk about COVID-19 vaccines. Getting immunized is crucial to making our workplaces safe and healthy for our patients and each other. We know vaccination is one of the most effective ways to protect our health. Scientific and medical evidence show that vaccination can help protect you against COVID-19. They're proven to be safe and effective. Getting a COVID-19 vaccine is a choice, but there's lots of misinformation that continues to circulate about the vaccine. We know that different people will have different feelings and concerns about COVID-19 immunization, and that's okay. But it's important that we have the same information. We need to support each other through this process to learn as much as we can from reliable sources so you can make an informed choice about getting vaccinated. That is why we've recently launched an awareness campaign to help our people get the information they need to stay safe and address different feelings and concerns about COVID-19 immunization. So joining us today to talk more about vaccine hesitancy are Dr. Kristin Klein, Medical Officer of Health, Provincial Population and Public Health, Dr. Lynora Saxinger, Physician and Medical Lead, AHS Antimicrobial Stewardship North and Co-Chair of the Scientific Advisory Group, and Dr. Stephen Sakrekos, Medical Director for Workplace Health and Safety. So welcome to you three. Kristin, I'm going to start with you. What would you tell someone who's worried about the safety of COVID-19 vaccines?
Well, maybe I would start by just echoing some of the statements that you already made, that it's okay that people have different feelings and that are concerned or worried about these vaccines. And it's really important to make sure that you ask the questions that you need to feel confident and know the right information about the vaccines. What we do know is that there's been millions of people that have already safely received a COVID-19 vaccine, including almost 2 million doses given in Alberta alone. There can be side effects from these vaccines, but the vast majority of those are very minor symptoms that go away quickly. The most common being pain at the injection site or just feeling a little bit under the weather for a couple of days after you get your shot. All of the health events after immunization that are a bit more unusual are reported to Alberta Health Services. And these events have occurred in about 1 in 10,000 people who have gotten a COVID-19 shot. About half of these are allergic reactions, swollen lymph nodes, or GI symptoms like having nausea or vomiting. And more serious adverse events like anaphylaxis, which is just an extreme type of allergy, are just very rare, occurring in about 1 in 100,000 people that have been immunized. So what we do know from both the clinical trials that have occurred and the ongoing surveillance that's done in Alberta and all over the country, we know that immunization is safe, and it is just so much safer to get a COVID vaccine than to get the disease itself.
Lynora, coming over to you, what is the most common misinformation that you're hearing amongst healthcare workers?
You know, it's interesting because I answer a lot of questions, and actually healthcare workers have pretty much the same questions as everyone else. They're exposed to the same waves of misinformation through social media and other sources. I've found that actually healthcare workers tend to be more reassurable on the science and medical side. I think where people might struggle more is when you have a very strong emotional reaction to hearing about a vaccine adverse event. And that actually can overwhelm your kind of scientific brain a little bit. And I think that that's an important thing to consider, because we don't actually hear about the adverse events of COVID. We don't hear about every single COVID death, but we certainly do have highly publicized cases of rare severe events about vaccines. And that kind of creates an uneven playing field for people when they're assessing risk. And I think that is just so important to kind of make sure that we really frame that correctly. I mean, we've had 50 to 150 deaths per day from COVID-19 across Canada during the waves of COVID in Canada. And the number of very severe vaccine adverse events that have been reported are like a handful in number, but they have a very high impact. And so it really is about making sure that we frame that appropriately for people, as well as providing them very good information.
Steve, just coming over to you, what should AHS workers be telling their peers, patients, and loved ones who have not yet decided to get immunized for COVID-19?
Well, I think all healthcare workers are seen as role models. And I think if they're strong advocates for immunization, it's going to have a positive effect on the people around them. And there's different ways to appeal to people in terms of talk about the benefits of immunization. We can talk about the personal benefits to themselves. I mean, some people might think that COVID-19 is a mild illness in a lot of cases, but in actual fact, we have seen, over 8,000 hospitalizations, over 2,000 deaths in this province. And even people who have mild illness can go on to get long-term symptoms after they've, started to recover. And we know that, in the ICUs, and unfortunately, people who have died, some of them have been fairly young, healthy people. So you have to ask yourself, why take the risk? Just immunize yourself and protect yourself. Then you can also appeal to people's altruistic nature as well. Maybe you're not so worried about your own health, but you need to think about the people around you and protecting your family, your friends, your coworkers, your patients. I mean, no one wants to be, thinking about bringing COVID-19 home to their families or to work to their coworkers, potentially, infecting patients, that sort of thing. Another thing you might think about as well is appealing to just nostalgia. Like remember the before times when we weren't, worried about, lockdowns and lineups. We didn't have to wear masks everywhere we went. When we could travel even outside of the country. Like, you remember travel? You remember going to concerts and, out to restaurants with friends and sporting events, and maybe, when your kids actually left the house to go to school, type of thing. This is all the way we used to live our lives, and we've sort of been used to the way things are now. But the sooner we get people to jump on board the immunization train, the sooner we can arrive at a stop called normal life and call this pandemic done.
Kristin, just coming to you, is there any truth to the perception that you've already had COVID-19 and recovered, that you don't need a vaccine?
Yeah, that's something we hear quite a lot. People think that because they've already had the infection that they're protected and there's no point in getting the immunization. What we know about people that have had COVID-19 is that the level of protection that they have really varies from person to person. There's not a set amount of protection that anybody gets. So some people might have very low levels of protection and immunity after getting infected, while others may have higher rates. We also don't know how long that natural immunity might last. So vaccines are really a much more safer and reliable way to have immunity and ensure that you're protected both now and for the longer term. And so we do recommend that any Albertans that have already had COVID still get the immunization. And right now they'd still be recommended to get both shots of the vaccine, regardless of when they had COVID or if they've had COVID before.
Lynora, I'm going to come to you next. We sometimes think that data is very important, and it is very important, I think, to sort of tell some of the stories. But in fact, as you said, some of the emotional attachments to how we make decisions are actually based on more personal stories. And so what are some personal stories that you can relay with us that really drives home the message, the importance of getting immunized?
No, I actually think that during this wave, it's been even more heartbreaking to hear stories of people getting so desperately ill and dying when in fact we're in the midst of a vaccine rollout that should prevent this. Like theoretically, this is all preventable. And so I've had lots of colleagues contact me to kind of debrief or vent about patients coming in dreadfully ill who just had their vaccine, like just had it. And maybe were feeling so relieved and so happy that they didn't take precautions for the ensuing few weeks, waiting for the immunity to kick in potentially. The other things that people are really discussing are people who've been eligible for immunization and have been on the fence about getting it or have had concerns about getting it and then get sick in the meantime. And that's actually quite a large proportion of what people are seeing come in. And even stories like within Alberta, families having very high household rates of infection. So someone brings it home, one parent ending up in a regional hospital, another parent at home in quarantine, and a child and a youth transferred to other centers for specialized and critical care. And I think about that parent who's at home with their family all over the place, dreadfully ill, and it's just terrible, and it's preventable. And for some reason, we always end up looking at numbers, but every single one of those numbers is a person, and every one of those people could be substantially protected by a vaccine.
Great, thanks very much. I'm going to add a question, Kristin, because I think one of the challenges, as Lynora just said, is that when people get vaccinated, they feel it's a get out of jail free card, right? And so can you maybe share with us, when you do get vaccinated, what can you do and what can't you do?
Well, right now, there's not enough evidence out there to say that the COVID vaccine is a get out of jail free card. I think we're all looking forward to a day that maybe that is the reality when people can have their 2 doses. And like Steve said, I'm also longing for the time where we travel and don't have our kids at home for school. So that is the place we're trying to go. But right now, with the evidence that we have, the advice is that the same public health guidance still applies. So for people that have gotten 1 dose or 2 doses, you still have to physical distance, you still have to stay home with stick, and you still have to get tested for COVID-19. So it's really important when we're seeing such high case rates still to make sure that everyone is still following those precautions.
Perfect, thank you. Steve, last question to you. Where can our staff go for reliable information about COVID-19 immunizations?
Well, I think we're very fortunate in AHS to have a lot of people who are very exceptional working for us in terms of teams and individuals, and our vaccine task force and especially our communication team have done an excellent job on Insight. And if you go to the main Insight page on the top banner, there's a little tab called Immunization Info. If you go to that, there's a wealth of information. It's regularly updated, lots of links, and I think that's basically your one-stop shop. And I think it's great that you don't have to worry about filtering through a lot of different information from different sites or different sources. All that is compiled for you in a one-stop shop. And I think it's a great piece of work by our communications team and our vaccine task force.
Perfect. Thanks very much to all 3 of you for coming on today. So just to reiterate, COVID-19 vaccines are safe, and vaccines are important tools to help us stop this pandemic. So we strongly encourage everyone to get the vaccine once they are eligible to receive it. By continuing to build trust, encouraging each other to find fact-based information, and having ongoing conversations with each other about COVID-19 immunization, we can maintain a work environment that promotes worker and patient safety. To see all available resources, visit insight.ahs.ca/sticktogether. Thank you again for everything that you do. Thank you again, Steve, Kristin, Lynora. We'll see you next time. Please stay safe, everyone.
Together, we do amazing things every day.